Over the last 50 years, we have had a very erratic roller coaster ride. It was perhaps during the time of the First and the Second World War that smoking was almost considered not only to be macho, but smoking was considered to be essential. There were packets of cigarettes which were sent by governments to young people as a welcome pact when people joined up for the army. In simple terms, if I used to smoke 20 cigarettes a day and now I have cut it down to 5 cigarettes a day, it does not mean that my risk of either a heart problem, a lung problem, a stroke problem has come down by 25% or is 25% of what used to be before. It's very, very difficult to come up with a very particular statistic to say that what percentage of the population actually smokes. Your guess probably is as good as mine. But the fact remains that over the last 50 years, we have had a very erratic roller coaster ride. It was perhaps during the time of the First and the Second World War that smoking was almost considered not only to be macho, but smoking was considered to be essential. There were governments, there were people who were actually sending free packets of cigarette, like you send the free packets of all the nice savories to our homes during Diwali, during Christmas. So there were packets of cigarettes which were sent as a part of greetings. There were packets of cigarettes which were sent by governments to young people as a welcome pact when people joined up for the army. So smoking was considered to be energy giving, it was considered to be macho. Without smoking, people were absolutely sure that smoking was as important to the soldier as ammunition was for the guns. And from those heady heights of misconceptions about smoking, over the last 20, 25 years, maybe 30 years, the world has turned around and we have come to realize that how stupid we have actually been. By this time, I know, all of us know the effects of smoking on lungs, on heart, on cerebrovascular disease, on lung cancer, and whatnot. But what is important and what has actually come to light over the last couple of years is research which is telling us that if we used to smoke 20 cigarettes a day and we have now cut it down to 4 cigarettes a day or 2 cigarettes a day, then we do not get the proportional benefit of reducing the smoke insult to the body. In simple terms, if I used to smoke 20 cigarettes a day and now I have cut it down to 5 cigarettes a day, it does not mean that my risk of either a heart problem, a lung problem, a stroke problem has come down by 25% or is 25% of what used to be before. Probably, at the very best, you can pick up an extremely small reduction in the disease risk if we have cut down the number of cigarettes from about 20, 30 to 5, 6, 3 to 1, God knows what. So this is a request, this is a warning to all the young people, to men and women. A lot of young women are smoking these days. And many of you would come and tell us that, look, I used to smoke 20, 25 a day. I have now cut it down to 2. If you say 2, I think it is 5. If you say it is 5, I will presume it is 10. But we want to tell you very simply, very honestly, very clearly, that if you have cut down from 2 to 20, it does not mean that you have reduced your risk by 1/10. You have not. Maybe there is a small reduction in risk, but the irritation remains. So, this is something we have learned through medical research. There is a link given in this report, which will give you the cross linkage to the British Medical Journal report a few months ago. We do not want to flood you with boring, threatening information, but this is something that young people, young men and women of today, will have to be very careful and very cautious. There is only one response to smoking, and that is stop.
যদি আমাদের আজকের ভিডিওটি ভালো লাগে লাইক ও শেয়ার করুন, জিজ্ঞাসা থাকলে কমেন্ট করুন। এরকম আরও মূল্যবান তথ্য পেতে আমাদের চ্যানেলটি সাবস্ক্রাইব করুন।